#1 in the morning. King 5 News starts now.
Keep talking about the little ones here in Good Growing. If your child seems sleepy when she or he awakes, maybe has some attention problems throughout the day, you may consider getting him or her checked for sleep apnea. It's not just an adult disorder, we're learning. In fact, just last year, Children's Hospital treated more than 500 kids with sleep apnea. Joining us for this Good Growing segment this morning is Dr. Maida Chen of Children's Hospital and Regional Medical Center. Dr. Chen, good morning.
Good morning.
I was surprised to learn that this many kids came to the Children's Center to be diagnosed and to deal with sleep apnea. What exactly is it? It seems to me that when people hear it, there can be so many variations of sleep apnea.
Well, apnea literally means without wind. It's a Greek term. These days, when we talk about apnea, we refer to it as a pause in your breathing during sleep.
Right. And that's, I think, what scares people. We know in adults with sleep apnea, you can stop breathing for sometimes up to 20 seconds. When you talk about a child, that could be very, very dangerous. Does the same thing happen?
Usually not. Most children, because they at baseline breathe faster and have smaller lungs, their apneic episodes tend to be shorter. So even as short as 5 or 6 seconds can be apnea in a child.
And that still can be apnea.
Yes.
Okay, let's run through the symptoms so parents who are concerned or possibly wondering if their child is suffering with sleep apnea, let them know what they are.
Sure. The most common symptom by far is snoring or loud breathing during sleep or breathing through their mouth. Other things that can happen is if they're gasping for air while they're sleeping, certainly if they're having restless sleep, tossing and turning a lot or sweating a lot during their sleep. They can have color changes while they're sleeping, turning dusky or pale. And ultimately, the thing we worry about is them having daytime sleepiness or fatigue, including dysfunctions such as bad behavior or poor school performance.
I want to keep that list up there right now because when I look at this list, and I have a 2.5-year-old daughter, she's very restless at night. I mean, kids roll around and tear the covers off and the stuffed animals hit the floor, and there's some loud breathing sometimes, or maybe what I would even consider snoring, yet she gets a good 9 hours, 10 hours at night, a couple-hour nap. So how would I know if that's a problem?
Well, it's really very difficult for parents to tell if their child has sleep apnea or not, which is why it's so important that if you suspect your child has it, to have them evaluated at a pediatric sleep center and ultimately to get a sleep study, which is what you need to diagnose sleep apnea.
Which may be needed as well because there are different types of sleep apnea, correct?
Yes. There are 3 different types of sleep apnea. The most common is obstructive sleep apnea, and that's when something is literally blocking your airway and preventing you from taking an effective breath. There's also central sleep apnea and mixed sleep apnea, which is a combination of obstructive and central, and those are not as prevalent in children.
You know, one of the big issues we're having these days is obesity with children. How does that play a role when it comes to sleep apnea?
Well, sleep apnea, obstructive sleep apnea, which is the most common form in children, is usually caused by large adenoids and tonsils. But certainly if you have an obese child on top of that, the neck circumference and fat in your neck as well as on your chest can also can prevent you taking an effective breath
exacerbate the problem if it's there. Longer term, how does sleep apnea affect a child as they move into adolescence?
Certainly, if the main thing we worry about with sleep apnea these days is the daytime function. If you are having poor quality of sleep at night with repeated apneic episodes, you certainly can have a decreased ability to perform well in school. We know that children with obstructive sleep apnea do worse in school in terms of standardized tests. They tend to have more problems with memory, attention, and hyperactivity. They have more mood swings. They may have more behavioral problems. But it also can lead to things like stunted growth as well as cardiac dysfunction in the long term.
Almost sounds like maybe some parents would be concerned, maybe my child is suffering from ADHD. It may actually be a sleep apnea problem.
It certainly can be.
It's wrongly diagnosed.
It certainly can be. And those kids should be evaluated for sleep apnea.
Dr. Chen, thank you for your time and your insight. We do appreciate that. If you'd like some more information on sleep apnea in children, just log on to king5.com and click on news links for more info there.
Thanks, Brad.